It is so important that people relax, that people facilitate the parasympathetic nervous system, because all the healing, all the good things happen in your body when the parasympathetic nervous system is active. You have two parts of your nervous system: the nervous system that you're aware of, and then there's an automatic nervous system that controls your heart rate and your respiration and your digestion and the size of your blood vessels, called the autonomic nervous system. And that nervous system has two components: the sympathetic nervous system, which is the fight or flight, and the parasympathetic nervous system, which is the rest and digest. Because our bodies are a series of interconnected feedback loops, when one of those systems, sympathetic or parasympathetic nervous system, is dominant, then the breathing pattern will change. When the sympathetic nervous system is dominant, chest breathing, shallow breathing, quick breathing. When the parasympathetic nervous system is in charge, diaphragmatic breathing, slow breathing. Because, again, we are a series of interconnected feedback loops, the breathing can influence which nervous system is dominant, or which nervous system is dominant will influence the breathing. So you can seize control over if your fight or flight or your rest and digest nervous system have their day in the sun. Your normal breathing pattern is about a breath every 5 seconds. And they found that if you can slow that down to about half of that, a cycle about every 10 or 11 seconds. So breathe in for 5-ish seconds, breathe out for 5-ish seconds, then the parasympathetic nervous system becomes stimulated. The sympathetic and parasympathetic nervous system can only equal 100%, so the more dominant the parasympathetic nervous system becomes, the less dominant the sympathetic nervous system is. We are geared towards the sympathetic nervous system. It is very important that you consciously stimulate your parasympathetic nervous system as often as possible, because as far as we know, there's not a tiger in the room, and there's probably not an ultimate threat to your tissues or your life. So she will find that if she breathes in through her nose and tries to enjoy the air as it circulates at the top of the nostrils, it is pleasurable, and she'll want to keep breathing in. And when she breathes fairly hard, she'll notice that she has to suck with her diaphragm, and that will cause her belly to rise. And then when she breathes out, her belly should fall. If she notices that it's just her chest rising and falling, she's not doing diaphragmatic breathing. It is when the abdomen rises, because the diaphragm drops down towards the abdominal cavity. She would like to take in a full breath, not that she strains at the end, but a full breath in and a full breath out. And again, slowing it so that she has about that 10-second cycle. It wouldn't be a bad idea for her to close her eyes, to feel the air, to kind of bathe in the experience. It's a good time to take inventory, to do a body scan, to see where she's holding tension. And if something is uncomfortable, can she alter her position? We have a cushion underneath her knees so that she's not too far from that 130-degree angle. When the knees are bent about this much, it really slackens the nerves and slackens the structures around the knees. If she had it so that her knees were pointing out slightly, so she had a little bit of hip abduction, external rotation, it really slackens the structures around the hip, sciatic nerve, low back. Generally a very comfortable position for people. Most people are fine as long as the pillow is giving them the adequate support underneath their neck. It should be touching the first rib, but not underneath the first rib or the rib cage, so it accommodates the lordosis. And then soft enough so it allows the cranium to sink into the pillow so that all the joints are in mid-range. She's not quite in a mid-range for her shoulders, but most shoulders are fine with that. If she did have a shoulder problem, then she could cradle her arm here And that usually puts the shoulder in a nice position, or if she has problems with the upper extremity nerves, this is a slackened position for the upper quadrant nerves, and usually the position of relief for people that have that upper extremity symptoms. You want to be as comfortable as possible, allow the parasympathetic nervous to have its day. It wouldn't be a bad idea to do this routine prior to doing the initial 8 so that you stop your day, let your mind relax, be able to enjoy and appreciate the change in tone, the change in stress on your structures during the rest of the initial 8 exercises, and then to finish up with this so that you really get some nice relaxation before you get on with your day. When you think about this breathing, it's pretty easy. And you're breathing all the time. It's just you're totally unaware of your pattern. So catch yourself when you come to a stoplight. Feel the air, slow your breathing down. Allow your diaphragm to move. When you change the page on your computer, pause, couple breaths, feel the air. When you come to when the commercial comes on the TV, while the commercial's on, do your diaphragmatic breathing. You are going to become more tomorrow what you are doing today. If you are a stress ball today, you're going to be a better stress ball tomorrow. If you are relaxed today, you're going to be more relaxed tomorrow. So choose your path wisely.